Hello everyone, my name is Nehal Sharma and I am a second year MBBS student at ESIC Medical College and Hospital, Alwa. Today I am going to talk about tuberculosis on the day of World TB Day. I'm going to talk about four things in this video: diagnosis, treatment, prevention, and elimination of the TB. So TB is much dreaded condition than we consider it, and out of the total world TB cases, there are approximately quarter cases that are present in India, which is approximately 1.25 million people in India who are suffering from TB. So yeah, it is a big issue right now. And about the risk factor of tuberculosis, there are many risk factors such as poverty and poor healthcare facilities, malnutrition, and some uncontrolled diseases like as diabetes mellitus, hypertension, which are not in control of the patient due to their negligence or anything. So these are the risk factors due to which tuberculosis can happen. And majorly, which is the most dreaded condition, is when tuberculosis is aligned with HIV. In immunocompromised states as well, tuberculosis infection is very common. So yeah, if you have had any surgery of transplantation and you are taking some immunosuppressants, then you have more chances of getting any tuberculosis infection than some normal people. So yeah, talking about the diagnosis of TB, there are some clinical features. If a person sees that he has a productive cough, which means there is sputum in the cough and there is or sometimes there is blood present in the cough, you have some chest pain or anything, then you should must visit doctor. And for diagnosis, we have many options, out of which some are like we have to do the Z staining, in which we take the sputum sample of the patient and then we give it to the microbiology lab. They do Z staining and they identify the Mycobacterium tuberculosis bacteria. And after this, we have culture media as well, like LJ media. In microbiology, we take the sputum sample and isolate the bacteria, and then we culture it. If there is bacteria present, then they will be grown in that. And some other methods like molecular methods, which are not preferred that much, but there are also some molecular methods like expert. And we have some other methods like tuberculin test. So basically, tuberculin test tells us about if there is any past infection of the TB or there is present infection. So tuberculin test is positive if someone had past infection of the TB as well. So it also tells about the past infection of TB and the present infection if there is any infection. And other than this, we can do a chest X-ray and we can tell about if there is tuberculosis infection. So yeah, these are the diagnosis methods of TB. Now talking about the treatment. So we have two-phase chemotherapy for treatment of tuberculosis, where we have two periods. First is the intensive period and second is the continuation period. So treatment of tuberculosis lasts for about 6 to 9 months, because and if a person is thinks that he is all right and he doesn't continue the treatment for 6 to 9 months, then it is more harmful for the patient, because they can develop the resistance to the drugs, and then tuberculosis can be more harmful and more dreadful because there will be no drugs for the treatment of tuberculosis then. And it is also a condition which is more prevalent which has more prevalence here nowadays in modern time. So yeah, in intensive period, we treat the patient with four drugs, which are HRZE, which are rifampicin and isoniazid, pyrazinamide, and ethambutol. So yeah, these are the four drugs in which we have to give the patient with more like intensity. We give the drugs to the patient, and it lasts for 1 to 3 months. And then there is a continuation period. Continuation period lasts for about 4 to 5 months or 3 to 4 months, in which all the drugs are same as the intensive period, but the pyrazinamide drug is eliminated. So rifampicin, isoniazid, and ethambutol drugs are given in the continuation period. So these are given so that there should not be the relapse of tuberculosis again. If there is a person is infected with tuberculosis and when we give the drugs and it does not affect the person again. So this is the reason why these drugs are given, and the treatment of 6 to 9 months plan is given. So yeah, if you are affected with TB, so please do not eliminate the drugs or stop taking drugs on your own. Kindly visit the doctor, and then after his proper approval, stop the drugs. About the prevention. So for prevention, we have BCG vaccine, which is Bacilli calmette-guéri vaccine, which is given at the time of birth to the baby. So yeah, if you are pregnant and you have going to have baby, so please do not skip the vaccination because some parents, for due to lack of education or anything, they skip the vaccination. So yeah, main prevention is BCG vaccine, which is important for the baby, which is against the tuberculosis, in which there is live attenuated tuberculin bacteria which are given to the baby, and then immunity is developed. So yeah, so basically, BCG vaccine is the main prevention. And other than this, there are some social measures like we have to eradicate the poverty, and we have to separate the, if we know that there is a patient with TB, we have to isolate him, like making him wear proper mask and having proper distance with him, because it generally spreads through inhalation of the bacteria through the so we have to keep a major distance. We have to keep a distance with the patient we know, and then we have to eradicate poverty. And if you have some diseases like if you have diabetes mellitus or any other disease which are lifelong diseases, then you have to take proper care of yourself. And uh, if you have already had a transplant before, and if you are in an immunocompromised state, then you should take proper care of yourself. And if you see any of this, like if you see any of the symptoms, or if you see, like if you have a mild if you have a mild feature also, like you can develop TB, you should visit the doctor. So yeah, these are the preventive measures that we can take. Now talking about the elimination, so whole world is working on the elimination program. So WHO has many plans for elimination of TB. So major of this plan was TB and program, by which we were like in by 2025 we will reduce the morbidity rate by 95% and reduce the new cases approval by 90%. And in India, we have also many programs like TB Mukt Bharat and various programs, National TB Control Program. So, which through which we are trying to eliminate TB, but with this also we need public support and many such things. Public should be more awakened and they should know about this more. So yeah, these are the measures that by which we can eliminate TB. So yeah, that's it for the video. Thank you so much for listening to me.